Okay, hello everyone. This is Dr. Shubhanshi, Senior Lecturer in Department of Prosthodontics, Crown and Bridge in the College of Dental Sciences, BBD University. So today we are going to study about the continuation of provisional restoration in FPD. In the last class, we have already covered basic introduction, the requirement of fixed provisional restoration, considerations of provisional restoration. So in this, we are going to study about the types of temporary crowns. It can be metal temporary crowns, plastic temporary crowns, or cellulite temporary crowns. Metal temporary crowns means it can be made of aluminum crowns, nickel, chromium, or stainless steel. Aluminum crowns are anatomical or non-anatomical. Anatomical, we know about it shows the anatomy of the cusp, while non-anatomical are flat surfaces, as we can see it in the picture. Basically, aluminum crowns are used in the they are indicated in the posterior teeth. Now the clinical procedure, how we will how we'll make the temporary crown. Suppose there are prefabricated crowns, there are various shapes and sizes. Firstly, we will decide on the which tooth we are going to make. That tooth we will select. Now, according to the size, we will measure it with the divider and we'll measure the prefabricated crown. Arbitrary, we will get a same size. So select the proper size and shape of the temporary crown according to the prepared tooth. Now trim the cervical margin of temporary crowns using a scissor to conform to the gingival margin of the penetration and to accommodate the vertical height of the prepared tooth. Now we'll check the vertical height. There should be a proper occlusion. There should be proper height. We'll cut the extra part with the scissor, extra part of the temporary crown with the scissor, and we'll accommodate that in the prepared tooth, and we will seat the temporary crown on the prepared tooth and ask the patient to bite on the. We'll check the margin and occlusal. So if there is any hindrance, if there is any hindrance, we will smooth the margin with the stone brush so that we can make a it doesn't harm the gingiva. Now cement the temporary crowns on the prepared tooth using zinc oxide eugenol cement. Okay. If the crown is rocking on the tooth, if it is rocking, so we will do the relining of the crown. How we'll do the relining? We will take the crown again. We will apply the Vaseline on the prepared tooth, and we will fill the crown with the relining material. We'll place the crown and ask the patient to bite again. So the excess of the material will come out. We will remove all the excess material. Again, we will finish the margin, and then we will place the crown, and then we will cement it with the temporary cement. Now, plastic temporary crowns. Plastic temporary crowns can be polycarbonate or acrylic temporary crowns. Polycarbonate temporary crowns. These are made from polycarbonate plastic combined with microfilled glass fibers. Preformed polycarbonate temporary crowns are available for anterior as well as for the posterior teeth. So these are the crowns which are made of polycarbonate material. And the polycarbonate material and the acrylic are almost similar, and they both are available in the various shapes and sizes for the anterior as well as in the posterior tooth. So these are made from acrylic resin and are available in different sizes and colors. So accordingly, we will select the proper shape, size, and aesthetic is also a concern. So we'll choose a color also for the temporary crowns. Now, clinical procedure for the plastic crowns. Select the most suitable size and shape of the temporary crown and cutting its margin according to the finish line of the prepared tooth. See, in the picture, we can see firstly they have measured the size of the tooth, and then accordingly they have measured the size of the crown. Seat the crown in the patient mouth. In the third picture, we can see they have seated the crown. Now, seat the temporary crown on the tooth. If it rocks on the tooth, it can be relined with resin material to improve its fitness. See, in this picture they are doing the relining. They are using they are filling the crown with the relining resin material, placing the crown. All the excess material is around the tooth. Now they have removed all the excess material, trimming is done. Now the placement of temporary crown has been done using temporary cement. Third one is celluloid crowns. These all three are they are prefabricated crowns. So celluloid crowns, they are mainly used for anterior teeth, but can also be used in posterior teeth. They are made up of very thin translucent layer of cellulose acetate. They act as a mold for construction of temporary crowns. They come in different sizes. So basically in the picture we can see they are a transparent mold like structure. In this only we are going to fill our resin material, and then we will place it into the prepared tooth. We'll remove the mold and we will finish off the material. See, in this clinical procedure that we can see, firstly in image picture A, there is prepared tooth. In picture B, they have got an accurate size and shape for the celluloid crown. In picture 3, they have filled it with the material. As the material has been set, the mold is removed and the finishing is done, cementation is done. Now, the second classification was based on the construction of customized temporary restoration. So, as I've said earlier, these three techniques are very important: direct technique, indirect technique, and the combination of direct and indirect technique. Firstly, direct technique. Before direct technique, I would like to explain how FPD is fabricated. See, firstly, before when patient came to the clinic, or it is we'll take the preoperative impression. Always and always we will take a diagnostic impression. Now the tooth preparation is done. After tooth preparation, we will get a post-operative impression. After tooth preparation, that impression we will pour and we'll get the master cast. In that master cast, the construction of FPD has been done. If once the construction of FPD is done, that FPD is only cemented into the patient mouth. The direct method. These are constructed with the matrix lined with the provisional material that is placed directly on the prepared tooth. This is direct method. See, first we have taken the preoperative impression. Basically, it is a putty index. We can call it a. This is not a putty index. It can be a impression, and it can be used as an index. Now the acrylic temporary material is being filled in that index. After the preparation of tooth, we see that impression in the mouth. Remove the temporary bridge from the mouth. Finishing is done, and cementation of temporary crown has been done. The direct method is always done in the patient mouth, and indirect method is done to the laboratory. Indirect method, these are constructed by placing the filled matrix over a model of prepared tooth. Thus provisional is constructed out of the patient mouth. So in direct technique, it was constructed into the patient mouth. In indirect technique, it is not constructed into the patient mouth, although it is constructed into the cast, into a model. So advantages of indirect techniques are there is no heat or monomer of the tooth, better margin fitness, and less chair time. Take a pre-operative impression. Now the FPD is being prepared, the preparation has been done. We have got the two impressions. First in one impression that we will going to send into the lab for the fabrication of FPD, and the other impression that we will keep for ourselves to make the temporary crowns. So the first in which it was written first, it was chair side temporary crown, and the second one has been set to the lab for the fabrication of FPD. How the impression is being made in the cast, it is clearly visible in the picture. Like in the direct technique, it was in the patient mouth, and in indirect technique, we can see that the matrix, it is filled with the material and seated into the master cast. Once the master cast, the material has been set, that matrix is removed, and now the temporary bridge has been formed. Finishing is done, and cementation of crown has been done. So if there is any rocking or something, then relining can be done easily. It is indirect and direct method. This technique include both patient. This include both in patient mouth also and in laboratory also. Basically, in this in direct technique we were doing in patient mouth. In indirect technique we are doing it in the cast, and in indirect technique we are what we are doing. We are making an FPD in the patient in the cast, but we are relining it into the patient mouth. These are made by forming a temporary in an indirect method and then relining this directly into the patient mouth. This method is useful when construction of temporary bridges because most of the work can be done in the laboratory. If there is single crown or one or two crown, that can be done with the direct technique or indirect technique. But if there is long bridge, then the indirect direct method is very useful. Advantages of indirect direct method is chair side time is reduced. Most of the procedure are completed in the laboratory before the patient's visit. Less heat is generated in the patient mouth. The volume of resin is used during lining is comparatively small. So in this, as usual, the impression is made. That we have achieved the cast. This is pre-operative cast. We will do the preparation in the cast. Now, when we will achieve the diagnostic cast, we will make a transparent vacuum formed sheet. After that, we will prepare an arbitrary preparation in the patient mouth. In the cast. See, as in the picture it is shown, we are doing the preparation in the cast. This preparation is not exact preparation, but it is arbitrary preparation. What we are going to do in patient mouth. We will make the temporary before the patient is coming for the FPD. Now, the template is placed over the model, and we will fill the template with the material. See in the picture, they are filling the material with the they are filling the template with the material. Place that material in the model, and we will receive a arbitrary temporary bridge. That arbitrary temporary bridge is now seated. Now it is seated into the patient mouth. So of course it will not be exact. It was not accurate. So for using this accurately, we will do the relining. See, now the relining is done. They will firstly apply the Vaseline into the abutment teeth, use the relining material, fill it with this material, and ask the patient to bite. All the excess material will come out, and remove the excess material. Finishing off is done with the burrs, and placement of cementation of temporary crown is done using temporary cement, that is zinc oxide eugenol cement. So these were the three techniques: indirect technique, direct technique, and direct indirect technique. This is a pictorial form of replacing a single missing teeth. See, suppose there is a missing teeth. Miss 6 is missing in this picture. Okay, now the diagnostic cast has been poured. The missing tooth has been replaced with the artificial tooth. Vacuum formed template is being formed using vacuum formed sheet is formed, and then preparation is being done. Or if you can do the preparation also, or you can do this in the master cast also. Now the material is being filled, and FPD, the temporary FPD, we have received the temporary FPD. Now this is also a single crown replacement using putty index. So if the prepared tooth is only one, we can take a small impression for only the tooth and adjacent teeth with silicone rubber based impression material. Basically putty. We'll make a putty index, and then we will similarly, it will be the similar process as we have done with the vacuum formed sheet. We will do this in the putty index. Pictorial diagram, we can see they are filling the material and placing it into the patient. This is for the knowledge. They are placing it in the typhoon, but they can place it into the patient mouth, and we will get direct temporary crown. So thank you everyone for this lecture. We will be continuing our next topics on the next lecture. Thank you.